Hi there, my name's Chloe Place. I'm a researcher from the University of Exeter in the UK, and today I'm going to be talking about the ExCHANGE collaboration, a collaborative team of researchers and care home stakeholders concerned with the health and happiness of those living, working in and visiting care homes. So I'm going to be presenting the initial findings of a realist informed evaluation of this collaborative model to support research co-production in long-term care settings in England. So to give you some background to the project, there are significant gaps between the activities of professional researchers, so the research they actually produce, and the practice needs of people who work, live in and care for others in care homes. So we established the ExCHANGE, the University of Exeter and care homes knowledge collaboration, as a creative way of bringing together researchers and care home stakeholders. Our care home stakeholders included local care home owners and family members who had relatives residing in care homes. So we aim to improve mutual understanding of research and evidence in long-term care homes. And we do this through various different project activities, but that includes workshops, which we co-designed and co-delivered between researchers and care home stakeholders, including making sense of evidence workshops, which were aimed at care home staff and stakeholders to introduce them to research and think about ways they could engage with it in their practice to enhance their care home practice, but also making sense of care homes workshops, which were aimed at researchers to help researchers who are interested in working with care homes and making care homes research to know how to go about that. And we've also, at the moment, we're currently setting up a taster research placement whereby a couple of members of care home staff are actually going to come up and buddy up with me as a researcher on campus. And I'm going to help give them some tools to equip them about how to use research to improve their everyday practice in the care home. So alongside this aim, another critical aim of the project is to generate applied research that focus on practice needs. And so we've been running project generation discussions with our family members, with care home staff, with even care home residents in the latter half of the project. This project began at the beginning of 2020. So in the latter half of the project, we have been able to get into care homes and talk to residents. And as a result of these discussions and needs, a small study was led by our researcher, Kath Wilkinson, on the impact of COVID-19 on care home staff wellbeing. So do look out for that when it's going to be published shortly. So the collaboration was created due to a successful funding bid for the Care Collaboration Programme funded by the Alzheimer Society and the Dunhill Medical Trust. And it's one of 3 funded projects in the UK. So we conducted an internal realist informed evaluation of the collaboration, and we sought to seek out and understand where and how the project had done well and where and how it had struggled in meeting its aims, which were understood from the perspectives of all those involved in the collaboration. So we gathered data using qualitative methods, including observation of events and activities, for example, recordings of the workshops that we ran, documentary analysis of project paperwork, and we've conducted semi-structured interviews with our care home providers, our family members and researchers. And then we're analysing the data using framework method analysis to develop a theory of how the collaboration could have or did achieve change. So we've got our initial results in, and what we found is that the collaboration did develop the capacity of care home stakeholders to engage with, understand, and use research by a variety of means. By including a diversity of care home stakeholders, so not just focusing on care home staff or just focusing on family members, but including a diverse selection of care home stakeholders, this really allowed co-production to work effectively. But also developing collaborative equal relationships between researchers and care home stakeholders to really try and break down that researcher-led hierarchy. And also ensuring that care home stakeholders participated in the everyday running and decision-making of the project. So coming along to project meetings and participating actively so that it really felt like a team effort. Also ensuring that all project activities were co-designed and co-delivered by researchers and care home stakeholders. And being really flexible and adaptable to the diverse perspectives coming into the collaboration. And this was particularly important given that we ended up operating through a pandemic and we had to obviously change a little bit the direction and format of the project. But also it came up as crucial using incentives to really reduce inequality in the collaboration by ensuring that our family members and our care home providers were compensated financially for their time. But our care home owners also mentioned that it was actually reputationally really valuable to engage in a project like this, as it really gave them a good image as well. We also found using accessible communication and language to be essential, really trying to avoid academic jargon so that everybody could understand and participate equally. We also found that the passion and enthusiasm of all our care home stakeholders and our researchers about care homes and about the health and happiness of people living and working within them was really important for driving co-production. And also, given that we were such a diverse group, it was important that we did have a project manager who oversaw project goals and that meetings were well facilitated. So because this is a realist informed evaluation, we've come up with mechanisms that positively drove co-production throughout the collaboration. So we've got 11 mechanisms. I'm just going to quickly run through these. So that's equality between all stakeholders, co-design of all project activities, having diverse engagement of a variety of different stakeholders from care homes, ensuring that we built relationships and collaborated with our care home stakeholders and researchers. That shared interest and care about care homes was critical. Being flexible and adaptable to changes in project direction, that was especially important with the pandemic. Using clear, accessible language throughout. Having rewards and incentives for people to reward their participation in the project. The passion and enthusiasm about the health and happiness of people living in care homes was really critical for driving co-production. Having strong facilitation and management, and also update ongoing communication so that everybody on team was on board all the time. We did run this pilot project. We began it at the start of 2020. So obviously we were faced with the big contextual issue of working within the pandemic. So although the care home sector was already limited, they were even further limited in terms of time and resources because of the pandemic. As it was a pilot project, the resources of researchers on the project was also quite limited. And we also found we wanted to be more closely connected to a care home collaborative in Devon, but because of the pandemic and competing priorities, we unfortunately only were able to have the reach of a couple of care home providers rather than having it with more, a wider reach of further care home providers. And also we wanted the project to be more embedded, so researchers going in regularly to care homes, but this has only been able to happen now towards the latter half of the project since the pandemic's eased off, as obviously people were not being able to get into care homes during the pandemic. However, we did find that switching to an online format did enable wider geographical reach. One of our family members isn't local, and we found that care home owners attended our workshops from further afield than Devon, which was great. Obviously, the long-term sustainability is complicated without further funding. This is just a pilot project, but we'd love to get funding to continue. I thought I'd put this up as it's a really fantastic, colourful, creative sketch note, which was created to display our work. And this is really to capture the work we've done and show, how people can understand what care homes are about and what care home research is about. So these are up on display in care homes that participated in the project. So just to conclude then, our study suggests academic practice collaborations can be effective in helping support care homes to develop capacity to use evidence in their practice, to mobilise and share knowledge between researchers and care home stakeholders, to identify future research needs that are critically practice focused, which will ultimately benefit the health and well-being of people working, living in and visiting care homes. Thanks very much for listening, and do send me an email if you've got any further questions or pop a message in the chat. I hope you enjoyed the talk. Thank you very much.